Hello. Schistosomiasis, scientific, social, and religious horizons. Again, liver fibrosis is the most important complication of intestinal schistosomiasis, especially schistosomiasis Manson with portal hypertension, splenomegaly, and esophageal and gastric varices. Eventually, patients may present with ascites, splenomegaly, hepatic coma, or hematemesis, which may be life-threatening. Pulmonary hypertension appears to be due to obliteration of pulmonary um, arterioles by granulomatous inflammation induced by eggs. Schistosomiasis hematobrewin could cause glomerulonephritis, fibrosis, hydronephrosis, and renal failure. Schistosomiasis is endemic in 74 tropical developing countries. Some 600 million people are at risk of becoming infected. It is estimated that 200 million people are already infected. Factors that aggravate the risk of infection include extreme poverty and an awareness of the dangers, the inadequacy or total lack of public health facilities, plus the unsanitary conditions in which people lead their daily lives. Simple and effective health education measures such as the elimination of discriminate urination and defecation in or near to water sources could be the mainstay of prevention in endemic areas. Schistosomiasis mainly affects adult workers in rural areas employed either in agriculture or in freshwater fishing sector. In many areas, a high proportion of children between the ages of 10 and 14 are infected. Urinary schistosomiasis affects 66 million children throughout 54 countries. In some villages around Lake Volta in Ghana, over 90% of the children are infected by the disease. As with other tropical disease, population movements and refuges in unstable regions contribute to the transmission of schistosomiasis. The large freshwater reservoir associated with dams such as Akosombo Dam in Ghana and Kinji Dam in Nigeria and the Caribbean Dam in Zimbabwe, as well as a small reservoir in the Sahel and irrigation systems throughout Africa, and are major transmission foci, and those form endemic areas for schistosomiasis. In endemic areas, including Egypt, schistosomiasis is a major economic and health problem, although the majority of patients suffer mild infection with minimal or no symptoms, yet the effect on the general health is evident in the northeast of Brazil and Egypt and the Sudan. The work capacity of rural workers has been estimated to be seriously undermined. The disease also substantially affects children's growth and school performance. However, medical treatment is rapidly followed by improvement. There is an association between urinary schistosomiasis and a form of cancer of the bladder in some regions. In Egypt, schistosomiasis linked with cancer is the primary cause of death among men aged between 20 and 44 years. In the industrialized countries, cancer of the bladder without schistosomiasis is usually prevalent among workers aged around 65. In some regions of Africa where schistosomiasis hematobime is prevalent, the incidence of cancer of the bladder linked to schistosomiasis is 32 times higher than the incidence of cancer of the bladder in the USA. Strategies for control. Schistosomiasis control should be considered as a major health priority. This should include a cooperation of several authorities. Among them are ministries of health, education, scientific research, advertisement, as well as Islamic authorities. Schistosomiasis prevention and control measures should be implemented before dam construction work begins. Control approaches for each form of schistosomiasis vary and must be adapted to the epidemiologic situation, available financial resources, and particular local culture. The main lines are health education. Schistosomiasis is primarily a behavioral disease associated with the human behavior in relation to water, especially canals. Strategies for disease control and treatment need to consider what people do. It is important to educate the people not to use the canal water for washing utensils and clothes or swimming. Drinking water should be clean, pure, and devoid from any forms of infective agents like Cercaria. Education should be carried on schools, mosques, health centers, social meetings, and by all methods of advertising. There must be teams of social workers and medical professionals all over the country. Special emphasis should be implemented on rural areas. Health education on schistosomiasis has greater importance than ever before. The introduction into 6 schools of methods of diagnosis and treatment has made children and parents much more aware of the problem connected with disease. School teachers and local health workers are effective in explaining the role played by people in the transmission of schistosomiasis. Campaign in the Egyptian mass media have proved particularly successful in increasing awareness of the need for diagnosis and treatment. Supply of drinking water and the planning of adequate healthcare facilities. The supply of safe drinking water is fundamental to schistosomiasis control. Improvement of hygiene and sanitation in rural areas lessens the risk of infection. It is of great importance to provide all villages with health centers capable of dealing with schistosomiasis from preventive, diagnostic, and treatment aspects. Also, diagnosis and treatment. Diagnosis is established by identification of the characteristic of in the feces, schistosomiasis mansoni, and or in urine, hematobianvirus. Significantly increased number of eggs excreted around midday. Tissue diagnosis by identification of eggs is also possible. In endemic areas, economic screening by the finding of gross or microscopic hematuria is cost effective in areas where schistosomiasis hematobium is prevalent. Several serologic tests have been employed. The beneficial results of chemotherapy, normally quite spectacular, are even more marked in communities with adequate water supplies. Appropriate drug treatment decreases worms burden and the intensity of infection as well as prevalence. Regular treatment of high-risk groups, particularly school-age children, is of utmost importance. Management of the environment. This includes providing rural areas with safe water for drinking and normal daily activities. For example, washing clothes and utensils, sewage control, and providing health ways of sanitation are important to control the disease. In addition, it should be considered to provide safe water for swimming in villages. Control the intermediate hosts, freshwater snails. The biological control of schistosomiasis has already proven its efficiency in several habitats in the Caribbean area. Two main types of biological control agents, either trematode parasites or competitor snails, have been studied and tested against distal hosts of schistosomiasis. In this region, biological control is probably safer than using chemical materials that might have dangerous side effects for men. Scientific research. Continuous research is very important to find better treatment medications and tools to eradicate the intermediate host, namely the snails. Egypt, the Schistosomiasis Biological Supply Program SPSP was established in 1989 with the principal aim of ensuring a constant availability of schistosomiasis material for schistosomiasis research program SRP. Investigators, diagnostics, vaccine development, chemotherapy, and operational research are included amongst the research components of the SRP, which is jointly funded by Egyptian Ministry of Health and the United States Agency of International Development. Treatment. Until the 1970s, treatment of schistosomiasis was accompanied by major side effects. Recently, scientific research led to protection of safe and effective drugs that made a breakthrough in the management of schistosomiasis. These are parasequental, effective in the treatment of all forms of schistosomiasis with almost no side effects. Oxymeniquin, used exclusively to treat intestinal schistosomiasis in Africa and South America. Metrophenate, effective for the treatment of urinary schistosomiasis. Modern diagnostic techniques are simple, easy to apply, and expensive. Although reinfection may occur after treatment, the risk of serious disease developing in the body organs has been greatly reduced, and it has been observed that there is marked regression of lesions in young children following treatment of the infection. In the majority of localities where treatment is provided, the total number of cases is reduced within 18 to 24 months. In other localities, according to the local situation, the prevalence has been substantially reduced, and it is encouraging to note that no further intervention is required for intervals between 2 and 5 years to be effective. Schistosomiasis control strategies should be adapted to the local epidemiological situation, and caution must be taken when destroying freshwater snails using chemicals, particularly in terms of impact on the environment. In 1983, the World Health Organization, in association with the health ministers of several endemic countries, Botswana, Egypt, Madagascar, Mauritius, and Zanzibar, launched a massive program to assess control methods. The findings of this program are single-dose parasequental is effective in reducing prevalence and in containing the disease. Schistosomiasis treatment must be accompanied by health education. Parasequental can be safely administered by primary healthcare teams. It is almost always necessary to repeat the treatment, but the interval may be up to 5 years in some situations where transmission is low. A simple and rapid test for blood in the urine using a paper strip soaked in a reactive agent is more reliable than a microscopic examination, which can prove difficult in the field. Role of prophytic guidance in the prevention and treatment. Protection is better than a cure is a golden concept adopted by Islamic teachings and prophetic guidance. Followers of these guidance are called upon to contemplate on the significance of the following prophetic sayings, hadith. The Prophet, peace be upon him, ordered Muslims against urination in standing, sluggish water. If this guidance is to be strictly adhered to, the roots of this disease could be eliminated, as well as it is well established that urine or feces loaded with schistosomiasis eggs, when placed in or near to water pools, ponds, or canals, is the sole source of infestation. The vicious circle could be significantly interrupted right there. The hadith, beware of the three cursed acts, defecation in water sources or roadsides and in the shade. Beware of the three cursed acts, defecation in water sources, on roadsides and in the shade. This is a comprehensive guidance which works at the roots of the prevention of several epidemics, including schistosomiasis, imbiasis, salmonellosis, and other waterborne disease. The hadith no harm is an authentic guidance which educates Muslims not to pursue any act or behavior that may result in harm to oneself or to others. Polluting water supplies in any way or form is a prominent example of such forbidden harm. Pollution, washing, swimming, or drinking from contaminated water are examples of non-compliance with prophetic guidance. Based on this hadith, Sharia guidelines were established by jurists that address health and other issues. These general principles and guidance include: harm should be eliminated, harm is to be prevented, harm should not be prevented by harm, weighing and comparison between welfare and harm, prohibition, pursue evil and harm. Islamic teachings that address seeking cure from elements are numerous. Listed here are only a few that illustrate this concept. For every element there is a care. Another version, a group of Bedouin Arabs asked the Prophet, peace be upon him, O Prophet of Allah, should we seek care? The Prophet said, yes, worshippers of Allah, seek care for Allah, peace be upon him, has not established a disease without a care except senility. From this guidance, we learn that seeking care is a recommended duty. For disease prevention, it is crucial for affected individuals to avoid spreading harm to others in their communities by receiving curative therapy in proper timing to render them free or of being the source of transmission. Also, there is a delicate meaning that encourages us in the medical profession to work and research diligently to find cares for many elements which have no satisfactory treatment until our present times. Where does the medical profession stand? Medical professionals, especially those active in Islamic medical societies or professionals unions, are called upon to be proactive in prevention and combating disease in their local communities. The following general ideas are pertinent in efforts to achieve this goal. Constructive cooperation with official health authorities for public education and awareness of preventive and curative measures for endemic diseases. All types of terms or media as well as the educational systems are extremely helpful to reach the grassroots. It is incumbent on authorities to ensure proper and safe water supplies, to conduct continuous surveys and provide proper and ample lavatory facilities and draining systems. Our communities in their towns and villages are privileged by the presence of mosques, imams, religious and social workers. Medical professionals are called upon to open channels of cooperation and understanding, mutual activities, awareness, and training with the aim of implementing prophetic guidance to prevent and combat disease. Continuous research through scientific and educational institutions is a right and duty of the medical profession to prevent and combat this endemic disease. This should include water purification, vaccine, early detection, and thereby therapy, snail, and parasite-related research in ways that cause no harm to water or environment. Medical professional societies should seek cooperation and understanding with their countries' health authorities, drug companies, as well as other supporting individuals and groups in their efforts to combat disease in their communities.